Esquimalt Railroads.
Thank you very much, Honourable Speaker. When the Ombudsperson released her report on seniors' care in 2012, one of her key findings was that seniors in residential care suffer when their care providers are constantly changed. She made it abundantly clear that large-scale staff displacements, and I quote from her report, disrupt the lives of seniors in residential care, especially those whose needs are complex and those with dementia. She also went on to say, and I read from her report, the Ministry of Health has not ensured that there are safeguards in place to protect seniors in residential care from the lack of continuity of care during large-scale staff replacements. So, Honourable Speaker, my question is to the Minister of Health. Will he explain today why his ministry is allowing the disruption of services for nearly 300 vulnerable seniors at 2 care centres in the Lower Mainland by displacing more than 300 workers in the next couple of weeks?
The Minister of Health.
Well, thank you, Honourable Speaker, and thank you to the member for the question, which we have canvassed previously in this House. Madam Speaker, we believe in making sure that our seniors are well cared for. We also need to ensure that our taxpayers are well cared for. So we provide the very best health care and always ensure value for money, Madam Speaker. So when Vancouver Coastal, after 10 years, decides to go out to the market for cleaning services with an RFP, we think that's appropriate, Madam Speaker, so that we can take as many dollars as possible and keep that in frontline care for our vulnerable seniors.
Esquimalt Railroads on a supplemental.
Thank you very much, Honourable Speaker. Well, I think the Minister misses the point. This is not about cleaning staff. This is about care providers to vulnerable seniors in residential care. Now, the reality is the endless contract flipping is a direct result of Bill 29 and this government's cavalier approach to contracts. But this government does not seem to care about that or take any steps to look after vulnerable seniors. Now, Harmony Court is home to 77 seniors who rely on 80 care aides, nurses and recreational aides, not cleaning staff. All of those workers will be laid off on April the 19th. In Surrey, 215 residents of Laurel Place are about to see their care disrupted. 240 care and support workers will be laid off on June the 1st. More disruption in the lives of frail seniors, many with dementia, who rely on continuity of care, exactly what the Ombudsperson warned us not to do. And yet this government continues to do it. So why is the minister unwilling to put an end to this practice and provide long-term, stable care for our vulnerable BC seniors?
Minister of Health.
Well, thank you, Honourable Speaker, and again, thank you to the member for the question, because I think she's genuinely concerned about vulnerable seniors in residential care, as I am. We met with the BC Federation of Labour recently on this particular issue. And I've spoken with the seniors advocate on this issue as well, Madam Speaker. And I tend to agree that in some very small number of cases, we've seen contracts changed rapidly, a lot of times over a short period of time. I find that that is impactful on residents, Madam Speaker. So we were going to work with the Seniors Advocate is doing a report on housing for seniors. I look forward to the work in this regard. I'm going to work with the BC care providers and discuss this particular issue, because we need to make sure that the lives of those vulnerable seniors are not negatively impacted by a constant turnover of contracts, while at the same time having a balance of finding the best value for money so we can provide frontline health care to the very best level possible.